Kiwis love being outdoors, so why not transform your outdoor living space with a sun view? With our quality range of stylish pergolas, outdoor blinds and awnings, having a sun view is like adding a new room to your home, but for a fraction of the price. Enjoy the outdoors all year round with a range of products to suit your needs. Book a free consultation now with SunView and see the difference.
Hospices across New Zealand are sounding the alarm over chronic underfunding, warning that without increased government support, many could be forced to shut their doors. Currently, hospices receive about 52% of their funding from Health New Zealand, and that leaves them to raise the remaining 48% through community donations and fundraising. This financial strain is becoming unsustainable, especially as demand for palliative care services continues to grow. Hospice leaders are now urging the government to boost their contribution to at least 70% to ensure the sustainability of these essential services. They argue that relying heavily on community fundraising is no longer viable, particularly in the face of rising operational costs and an ageing population. In response, the government has acknowledged the funding challenges and expressed a commitment to reviewing hospice funding levels. However, no specific plans or timelines have been announced. Wayne Naylor is the CEO of Hospice New Zealand, and it's my pleasure to welcome him back onto the show. Hello, Wayne.
Hi, how are you doing today?
Well, I'm doing well, and it's good to talk to you, Wayne. Are hospices at crisis point?
They definitely are, and it's been something that I think hospices have tried to, not keep hidden, but to not expose, because you don't want people to worry when they're at the most difficult time in their lives that their hospice might not be there. But the reality is that this is happening. It's been happening slowly for a few years now, with hospices slowly pulling back services to manage within their funding. But it really is at a point now where if nothing is done fairly urgently, we're going to see some hospices and their services tip over the edge.
How close are some from actually shutting the doors right now, Wayne? Have some already shut?
So I think we're not going to see hospices close their doors, at least not for a little while. But what we're seeing is that they are reducing their beds. So hospices that have inpatient units, especially post-COVID, just didn't open some of the beds they'd closed because they didn't have the resourcing and staff or the funding to pay our staff properly. That's a whole other topic at the moment.
Yes.
They're doing things like restricting the number of patients they have on their service at any given time. So some people might have to wait a bit before they're accepted into a hospice. They're having vacancies. They're keeping those vacant so they can save money there. So it's happening, and it's a bit of a roller coaster now because things are getting worse. And I think if nothing happens in the next 2 or 3 years, there's going to be probably some significant contractions in hospice services available in a lot of communities around the country.
So 48% of funding comes from community donations and fundraising. You've said it's no longer sustainable. Can you explain the points behind that? Why?
So there's a few things, and actually just reflecting back on 2020 during COVID, that really exposed how fragile community funding is for an essential health service, because hospices had to close their shops, they had to not run major fundraising events. So it exposed that real challenge for us. But we're also now, we've been experiencing a difficult economic environment for a few years now, and that means that people just don't have the spare money to give. So asking people to donate, to attend fundraising events, that's a challenge. Our second-hand shops across the country, they bring in a lot of money for hospices, but again, it's one of those balancing acts. People want to buy second-hand products because economically that's where you get stuff from, but people just don't have the spare money to support charities and supporting hospices for the amount of money we raise. It's $112 million a year from the New Zealand community. That's a big ask.
Jeez. Yes, and a lot of the shops, not just hospice, Wayne, but, the SPCAs and other charities that run shops, Salvation Army, they're all reporting the same. So I understand it's money and people just don't have it discretionary at the moment. Is there an example of something at the moment the hospice can't afford right now, or they've pulled back? You pulled back on already. Besides, you mentioned beds.
So,
Is there any?
so the inpatient beds is one of the most expensive parts of operating a hospice service. So that's an area where hospices are seriously looking at saving money. But, I would say some of the nice to have things, hospices provide nurses, doctors, counsellors, social workers, but you also have a lot of therapists. And unfortunately, they bring a huge amount of value, but they are often one of the first roles to go because they're not seen as essential by Health New Zealand. And so the funding doesn't always stretch. What we would like is for Health New Zealand to be really clear about what it wants to purchase that meets community need and to pay the appropriate price for that service. And then hospices and communities can add onto that with some of these nice to have things in inverted commas, but relying on communities to fund a third of the clinical care that hospices provide just isn't really realistic for an essential service that makes such a difference to people's end of life.
It's so difficult, isn't it, Wayne? Because we know that Health New Zealand, the money goes so far with what they have, and you've got surgeons wanting, they were striking for more money. You've got people on the waiting list. It's never ending. And then, GPs, they're saying they need more doctors. It costs a lot to go to see the doctor. And then you've got, obviously, the hospice who needs help as well. It's a lot of help needed for limited funds, I'm saying.
Yeah, and so we would say that hospice is a really smart investment for the government. So some recent research by the well-respected firm Martin Jenkins, commissioned by 5 of our member hospices, shows that at a conservative estimate, hospices saved the health system, or saved it last year, around about $110 million by keeping people out of emergency departments, keeping them out of hospitals, saving money on GP visits. So that's nearly as much as what the government invests in hospices on top of all the care that hospices provide. They're saving the health system an awful lot of money by freeing up resources in our public hospitals, which is exactly what the Minister of Health wants. ED's doing better, hospitals doing better. We can help that happen, but we can't do that if our services are having to contract because of funding problems.
What does this kind of toll, the situation take on patients and families, Wayne?
Well, I guess the biggest concern is that people won't be able to access the hospice service when they need it. If hospices are having to run a waiting list, then people are not being admitted as early as we would like and as they would like, because we know getting involved earlier for palliative care and for hospice care is how we make the most difference. Their families will miss out on grief and bereavement counselling, and the Martin Jenkins report shows that through hospice care and support, those people can get back to work sooner, children get back to school sooner, so there's an economic benefit there as well as social good. So those are, it's a concern. If someone can't access hospice when they need it, they could be at home suffering and in pain or having other psychosocial problems that we could help with, and we could make their life better when it really needs to be better.
Kiwis love being outdoors, so why not transform your outdoor living space with a sun view? With our quality range of stylish pergolas, outdoor blinds and awnings, having a sun view is like adding a new room to your home, but for a fraction of the price. Enjoy the outdoors all year round with a range of products to suit your needs. Book a free consultation now with Sunview and see the difference.